Welcome to PS with Jen. Today we're going to talk about navigating your aesthetic journey. Are you just getting started in your aesthetic journey? Are you established in your aesthetic journey and aren't really getting the wow results that you're looking for? We are actually going to debunk some of the myths of doing less is more and making sure that you understand what strategizing carefully can do to deliver the outcomes you're looking for. Very often we're receiving client requests for appointments. They come in saying they want what their friend has, but we don't realize that we're not all the same. Our requirements of aging gracefully and making sure that we maintain natural results, support short-term and long-term goals is so important to start with a thoughtful consultation. Once you've called and scheduled your appointment, Allie will make sure that we meet together to review all of your today's goals, as well as any events or upcoming strategy that we may need to feel and look your best at a special occasion. When you come to me, I want to know all that you have going on, maybe services you've previously had or what you are curious about. I know Instagram is spamming all of us and making sure that we know about what's trending, but not all of those things are going to deliver the desired outcome that we hope to achieve. Our friends are different. Everyone's needs, wants, and starting points are going to be different. Prevention is actually something I always hope to be able to share with everybody. I know my two oldest children are now teaching their friends about sunscreen and making sure that they are being proactive in their aging process, where I didn't start mine until my late 30s because I just didn't even understand what was out there and what possibilities there were. When I was first curious about aesthetics, my husband was more concerned about me coming home not looking like me and not feeling like I was going to stay not looking crazy. And so I wanted to make sure that I always not only built confidence that the partner could come in here confidently, they could go home and share what they were investing in and to feel and look their best self. We start with the consultation because it's important for people to realize these aren't willy-nilly treatments, they are medical. And it's important to use proper assessment and proper science and proper products in order to deliver those outcomes that we're looking to achieve. When we sit in the room together, Allie has thoughtfully curated the amount of time that we need to spend together and has already taken a medical history to make sure that I can see, is there any of our services that aren't in your best interest? We want to make sure that we understand if we have a timeline that we need to meet our outcomes by, because we have some that are short term and some that take a lot longer to achieve. When you sit in my chair, I listen to your concerns, and very often, more often than not, I am going to make a recommendation of something that is a little bit of a spinoff of where you've started. The reason for this is because I'm looking at your anatomy from top to bottom and making sure that you understand all the layers of aging. We have bone that we need to protect. And as we age, we are having bone reabsorption, which will open up the eye sockets, that will widen the nose, elongate the ergotride space, our upper lip, and shorten our jawline. These are things that take us from our happy, rested, refreshed self to sad, mad, and tired. At Powell Studio, our goal is not to change your appearance and to change you into someone you're not. It's just to leave you feeling rested, refreshed, and natural. We are going to start with assessment at the temple, looking for 5 different things that we want to make sure are in place to see the level of priority of where we're going to treat. So we're looking at a temporal break, a bony prominence at the lateral brow. We're looking for a drop-off at the hairline and a drop-off at the lateral cheek. These would tell me in my medical assessment whether or not your temple was something that we needed to address before we went and addressed the common areas of concern. Nasolabial fold, lips. People want to freshen up and do the things that are trending. A lip flip. All of these little things, although are fun, aren't usually what's in your best interest in order to leave those natural results. Next, we'll look at the under eyes and just see, is that tissue healthy? We very often get people saying that my eyes look tired. I want to make sure that they look refreshed and they're requesting dermal filler under the eyes. This is not going to lead to a beautiful outcome. We want to talk about things that are more like our own blood that we can re-inject under the skin, or the proper ZO products that will boost collagen. And so helping you to understand the different layers under the eye of fat pads, bone reabsorption, and thickening the tissue will help to leave that eye looking rested and refreshed. refreshed. So we're going to assess that next. When we go further on down, we're talking about the medial cheek. This is our big support system for under eyes, and we want to make sure that we have maximized the opportunity for volume. This helps to lift the lower face, which is going to create some of our symptoms of fine lines or sad face or jowling that people are really concerned about. You don't want to go and start addressing symptoms. You want to get to the root cause of the problem. That is going to start all lateral and posterior and lifting. I've noticed when I am teaching, whether it's in Powell Studio Academy or when I'm addressing a patient, they're concerned about their friends who are looking wide in the lower face, and this is what comes along with addressing symptoms. Today, I want to make sure that you understand when we're filling cheeks that we have strategy, feminine versus male goals, and that we need to talk about those as well. We want to work our way down and talk about the nasolabial fold. That's fine tuning. And then we can look at maybe lips. I have so many people who come in here and they're like, I would love lip filler. We have so many muscles that are animating and creating the whole lower face support. As women, we don't have a fat pad or the same muscle like men do because they have a hair follicle that's supported there. And so if you treat and address just the lips with filler, they're going to look done. We want to make sure that when someone comes into the office and we talk about addressing hydrating lips and making sure that they look natural in yours and that they don't disintegrate off the face, this is definitely a concern that we have when we are addressing skin health and making sure someone feels confident that they are scared to do the lips because they've seen poor outcomes. You also don't want to look like you did everything else and then became afraid. So we say never. We know that building trust in our appointments is going to be required, and that's where our relationships come from. Many people think, okay, I can come in once or twice a year and I can get these beautiful outcomes, but really consistency is key. We use these analogies like you can't go to the gym 3 times and get a 6-pack and make it last. Well, your skin and your services that you do in aesthetics are the same. And so when we have an opportunity to support you, we're thinking about all of the levels. Is your skin healthy? What stage of aging are you in? Do you have bone support? We want to make sure that you have a clear expectation about how long it's going to take to achieve your goals. We've noticed that patients sometimes think that if they come in less often, that they will be spending less money. And this isn't the case. We want to be consistent with your treatment plan. We want to make sure you don't have to be in here every month, but we want the strategy so that you know if I'm just getting started, how often I need to come in right out of the gate in order to get to my goal. I might need to have 3 closer sessions, and then I can start to spread them out a little bit more because I've been able to achieve the outcome. When we're doing skincare, we have 3 skin cycles. They're each 6 weeks long. So if you have never used anything more than I was using when I started, Neutrogena, Oil Volée, oh my God, Oxypads, we had all these different opportunities to do pore skincare. And we ended up coming to the conclusion that ZO Skin Health was our one and only option for patients because we're so committed to skin health, just like Dr. Obagi. We want to make sure that we're protecting your investment in here and that if you're making a recommendation of injectables or other services, that it is going to come out the best and last the longest. And that's with good skin health. If your skin is not having daily regimen of even just your core 5 principal products of ZO, where we are cleansing, gently exfoliating, having our pH balance with toner pads, and using Daily Power Defense, which is our barrier protection, then your skin is inflamed. And so you may get some improvement, but it will not be as robust as if you had preconditioned the skin, and it won't last as long as if it would if you were to continue with maintenance at home. As we conclude our assessment top to bottom of what areas we want to address, we have few options that I always make a recommendation for when we're treating. We think about the time and the cost of our products in order to create strategy. So we notice when people tiptoe into their treatment plan that it ends up costing more money and it ends up taking longer to get to the outcomes they're trying to achieve. And so we've thoughtfully strategized whether it's a filler package where we're treating all of the areas areas of concern at the same time instead of just fixing one area and then waiting for another appointment in order to correct the next. So having that strategy is something that we'll create in that same consultation, and you can see where we're going to get started. Maybe we only start with one part of the consultation, but we may end up doing all of it and scheduling it all out. So we love to make sure that your year calendar is organized, and so you can ask questions, you can refer to it when you leave. If you're just on a willy-nilly appointment where you're making the recommendation, the provider is doing exactly what you asked of them, and there is no communication about your assessment, there is no follow-up plan, be cautious about where you're where you're investing. I want to make sure that there's not waste there. It's really vital that we can strategize debunking the stigma that goes along with aesthetics, and this is a huge part in order to do that. Completing your consultation and really taking advantage of your yearly treatment plan allows the relationship in Powell Studio to build so we can support you every step of the way. We've also come to realize that our community of VIPs have really brought support to each other. And that is why we created the society at Powell Studio. This has been branded over years. We started with membership and didn't seem like it aligned with really our goals of protecting your investment and making sure that we optimize outcomes. When I teach and when I treat, I hear all the time, wow, I didn't even anticipate that this outcome would be this good, or wow, this is way better than I ever imagined, or this isn't an outcome that I have been able to achieve on my own as a provider in the past. And it's because there's strategy every step of the way. And because there is community of understanding, we build trust over time, which allows us to navigate into treatment plans that one wouldn't normally pick on their own. I know we have access to a lot of information on the internet, but it doesn't always navigate into a space of what we should be receiving for a treatment. The strategy, transformations, and relationships that used to be known as VIP Gold, VIP Platinum, and VIP Diamond have now been curated and elevated to the Society Essential, Society Elite, and the Society Signature experience. Each tier was specially curated to make sure that we are optimized your opportunities to take advantage of our loyalty lounge, to attend our 6 society-only events. We want to make sure that you are in the right tier that's going to best meet your needs. If you're only prioritizing skin to start, if you're ready for the next level of injectables and maximizing outcomes in those opportunities, we will pick the best signature experience, best elite experience, or best essential experience, depending on your goals that we will be able to navigate at your consultation. For more information on the society, please reach out to us. Thank you for tuning in, and we'll see you on the next episode.